Hello, everyone. Thank you so much for helping on. My name is Ransom Nyema. A final year radiography student, passionate about medical imaging, and patient care. Apart from my studies in radiography, I'm also a proficient medical writer, and I also run sorry, which makes me a YouTuber as well. So, yeah, I have an amazing guest speaker today. Um, Her name is Chaundria, if I pronounced it correctly.
Yeah, that was,
So, yeah, could you introduce yourself to the audience?
thank you for having me, Ransom. I appreciate the invite to your audience. I am Chaundria Singleton, a radiology technologist by trade. I've been in the profession over 20 years. I do multiple modalities and many things in the profession over the last 20 plus years. It has been an absolute joy, and I've learned so much in this profession and really learned what this profession has to offer. So, yeah, I've done being a technologist. I'm still a technologist. I still scan all modalities. I work in all type of machines, different facilities. I'm still educating myself. I'm still learning. I'm not quitting anytime soon. I've done clinical applications, education, um, leadership, and a host of other things. And that's what my purpose is to show people that medical imaging is more than just taking x-rays of people's bones. There's so many things, and it's not a profession where you don't have growth opportunities. You hear that a lot. Don't go in an X-ray, taking X-rays because that's all you'll be able to do. Well, they don't understand what all we are able to do. So that's my purpose in creating content.
Amazing, amazing. Wow, she has a whole lot of experience, in the radiological, space. And if you're interested or already in the field, I assure you that this session will be a very enticing session. So, Chandra, we have a couple of questions for you to answer. You ready?
Yes.
All right, the first question is you've been very vocal about the idea that medical imaging and radiation therapy, shouldn't be treated like a side hustle in healthcare. Can you share what inspired you, to have that perspective?
Well, I am naturally an entrepreneur. I have owned my first business since the age of 13. And I come from an entrepreneurial family, and I understand that as an entrepreneur, sometimes you can put your all into something. And then sometimes you look at it as my little business, right? We've heard people say that I have a side hustle, I have a little business. And most of the time when we treat our um, entrepreneurial uh, quest like that, then we usually don't put our all into it. We don't really view it of what it could be, which could possibly hinder its growth and hinder what it can do for us. Whereas when you hear somebody use the term, this is my job, this is my career, there's a whole different take on that. Their motivation for how they work in it, how they view it is totally different. When you hear entrepreneurs say, this is my career, this is my business, there's no little, there's no little side to it. And sometimes when it comes to medical imaging and radiation therapy, I'm not talking about the other people, I'm talking about us. Sometimes we put the side hustle in our own profession, or we're just x-ray techs, or I just do treat radiation. I use radiation to treat cancer. We just do these things. But I saw a need for us to understand that we do more than just. And I feel like a side hustle in healthcare is very relatable, no matter where you live, whether you're in the United States, whether you're in Nigeria. Everybody's got a little side hustle. They know what a side hustle is, right? You know what a side hustle is. I know what a side hustle is.
Yeah.
It doesn't matter where you live. You know what a side hustle is, and you know what comes with somebody having a side hustle. They got to work hard. They don't have much payoff from it. But when you look at medical imaging, people look at us as beneath everything else. And we are the third largest in our nation, at least. I'm not sure about Nigeria, but in the US, we are the third largest medical profession in the nation. We carry, outside of cardiology, most hospitals' financial structure. Imaging. Imaging accounts for a lot of money coming into hospitals. There's no side anything about medical imaging and radiation therapy. And that is what I immediately thought of when I thought of that quote when I was creating content, it just came to me because, like I say, I have a couple other businesses, and I was thinking to myself, we're not a side hustle, but people try to treat us like we are, and sometimes we view ourselves like we are. So that is why I'm vocal about it, because I know what medical imaging has done, not only for me, but several of my colleagues. I know people who've done some amazing things and are doing amazing things because they went to school for medical imaging and radiation therapy.
Amazing. Amazing. Wow. You know, radiography is the eye of modern medicine. I think they should know that it shouldn't be tagged as a side hustle. Never should it be tagged as a side hustle, because I can't imagine a hospital setting without radiation therapists, radiographers, radiology technologists working in that session. How's the hospital going to cooperate without imaging procedures? It can't work.
Well, we
You
do a
know,
lot. What people don't realize, I was just on a
yeah.
show. I helped someone to understand that without a CT scan, when I do CT scans, people come in with just abdominal pain. They don't know why they
Mhm.
have abdominal pain, but because they get a CT scan, maybe after an ultrasound that's not clear or saw something and now that it needs to be clear, if you didn't have imaging, you would have a lot of people getting unnecessary surgeries or nothing
Yeah,
at all. So that
yeah,
is just one example of how important medical imaging is to health and diagnosis and to saving people from getting cut on. Nobody needs to have surgery. It has to have surgery unless you need it. And with imaging, you can be less invasive and still get the answers you need
yeah.
accurately.
Absolutely, absolutely. In the theory of radiography, that's why surgeons work in accordance with we in the medical imaging department. Without us, there'll be a lot of couple of mistakes in terms of the invasive surgical procedures. You know, I could remember something where I did my clinical rotation. You know, a patient got, like, I don't know, I think he got shot or something. There was a bullet in his femur, towards the femur region, the thigh region. So with the theater radiography, you got to do like fluoroscopy and all those things.
Right.
um yeah, with that real time imaging, it showcased to the surgeons where exactly to put in those surgical stops on the patient. That is the important reason why imaging people in the imaging department should be given some respect, should be given some accolades. Is never a side hustle. Thank you so much for being the voice of we. I'm already in the training, almost going to graduate very soon, but the God's grace. But
Yeah,
you
and
know,
also we have to, outside of other people, how they view us. I,
yeah,
I honestly don't really care what people think about, me. And I feel like we as medical imaging, we shouldn't either. We should know from within that we don't use the terminology just or us, or we treat ourselves like we're not as deserving of any other healthcare profession. We are. We might not get all the
mhm,
discounts from certain scrub companies and everybody else, but that doesn't mean anything. So I mean, I just feel like from within we need to know amongst ourselves our value. And that is where that line came from, is to instill in us and remind us that we don't need other people to accept us. We know what we do and we know
yeah.
why we do it and we know who needs it. So
We know what we carry. Thank you so much, Chandra, for your thoughtful initiative in that question. On how you came about having the perspective on talking down on people that assume or presume that imaging um people working in the imaging department should be considered as people that have side hustles. That shouldn't be. But thank you so much for talking to us there about that. So the next question for you is, yeah, this question is very intriguing, but I know you're ready for it. So with your experience across radiological, modalities like MRI and CT technologies, how do you think each of these roles uniquely contributes to patient care, and what do people often misunderstand about them?
Well, I feel like all modalities. It's so funny. I was somewhere today this morning, and a young lady walked up to me and said, "Are you on TikTok?" And I said, "Yeah, I'm on TikTok." And she said, "You do radiology, don't you?" And I said, "Yeah." And she said, "I knew it was you." And I'm like, "Oh my goodness! Like, what in the world?" But this is the point. She's trying to decide. She was going to school for cybersecurity. She wasn't sure about radiology or what it was. She had heard from people, you're going to get cancer if you become a radiology technologist. So she zeroed in on ultrasound and specifically echo. She asked me a bunch of questions, like she wanted to, she's sure about echo and she loves the cardiac part, but she just wasn't sure if she should possibly apply to a radiology program. Now, I'm pro going to school for radiology technology first. That's me. I'm pro that because then you get every other option available to you. That's here in the US. I'm not sure about in Nigeria, but we can have multiple areas where we enter medical imaging. We don't have to just go in as radiology technologists, which works for some people to go in as radiation therapists, nuclear medicine techs, ultrasound, or radiology technologists. And then there's one more. I'm forgetting another one. But there are 5 ways to enter medical imaging here in the US. I'm pro going in for radiologic technology, then everything is open to you with minimal certifications after that without having to go back to school. So that's what I explained to her. And as I was breaking it down to her, showing her how each modality crossed each other in some way. I went to school for radiology, which opens up everything to me, even though MRI has nothing to do with ionizing radiation. I learned CT next, which are the same principles as radiologic technology, just cross sectional. And then after that, I went into MR. Same principles when it comes to cross sectional, but yet it's not ionizing radiation. But the way they crossed over was pivotal for my strategy in my career throughout the 20 years. And now you look at radiation therapy crossing over into MRI, CT and nuclear medicine crossover, now PET and nuke med. There are so many ways that people don't understand, even people thinking about going to school for it, they really don't understand how these multiple modalities as a technologist really can shape your career. And then to patients, how these modalities get to see different things. So I overheard a conversation. My husband and I were eating, and there was a young girl on the phone, and she was saying how they wanted me to get an MRI and they wanted me to just lay on this scanner. I was not going to do it because they told me how long I was going to be in there. And I've seen too many TV shows. She said, but then a lady explained to me, this is the best test for whatever it was they needed to see. She said, so it took me a while, but I got over my fear. But I'm glad she explained to me why I really needed this exam. And that's the thing. I think many misunderstandings happen about our profession and people don't go through with their test because they've seen a TV show. That is entertainment. That is not accurate most of the time. They got to put a little spin on it to make you enjoy coming back to their show. But the great thing that we as professionals can do is talk to our patients, educate our patients on what we do. We go to school for this, not for 6 weeks. We get a minimum of a 2-year degree in the US. You can get a 4-year, you can get a master's degree. It's your choice what kind of degree you want. But we are educated and we get schooling that helps us to be able to do our job in an educated fashion, in a proper, safe fashion. And I think when people know that, they have a lot more respect for us. And then for people who are looking to gain a career, when they truly understand that, yes, we make good money in this profession. Yes, it's a great job, but there's so much more to it. And when people understand it before they get into the profession, I think that clears up a lot of misunderstandings on both sides.
Mm, 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 mm. Wow. Thank you so much for that one, Chandra. That was amazing. That was amazing. Because both modalities are quite different in some way, because CT, you know, in a layman's understanding, is like combination of X-rays and computers together. It uses ionizing radiation as well, but MRI doesn't. I think during my studies, I'm thinking that MRI is one of the modalities in radiography that is more safe. Is that true?
Safe in what manner?
Like, like um For instance, X-rays. We have to hide under the lead wall because of radiation or something, and because MRI doesn't use ionizing radiation, of course, so it doesn't emit like radiation kind of like particles.
Yeah,
So
you
does
don't
that?
get ionizing radiation, but you have radio waves. You have harm in MRI where it could be projectiles. You see accidents all the time, on
Mm,
social media, on news, where the wheelchair goes flying in. It's been some cases across the world with people thinking MRI is just, it's not radiation, so you're safe. It's so far from the truth. I feel like my antennas are more raised when I do MRI versus when I do CT or X-ray. I don't really have
mm,
the stress of someone walking into the room while I'm standing next to the scanner with the wheelchair that's not safe. I've been in situations where I've worked with people in departments and the facility did not really follow safety protocols. The technologist didn't really follow safety protocols and almost had a wheelchair come flying at me and the patient, as I was positioning the patient on the table, because this tech thought she could get the wheelchair, the unsafe wheelchair, a little closer. And it wasn't supposed to be in the department at all, but she had seen other techs do it. Well, I would have been the one hit by it. So for me, I consider every part of every medical imaging modality is going to have some areas that are not safe. It may not use
mm,
radiation per se, like radiation therapy. They have to adhere to certain other safety parameters. Nuclear medicine has to deal with other safety parameters. Patients are radioactive at times. They have to deal with their patients in a different way. Whereas when I put contrast in my CT patients, they're not going to leak any radiation or anything towards me that's harmful. So I don't have to take certain precautions. But whereas other things we do are more invasive, we deal with blood, we deal with bowel, things, urine. We have bodily fluids that we have to deal with in our modality, whereas other modalities don't. So I feel like there's safety is a word that I don't feel
yeah,
like any of us have a safe modality. I would
yeah,
say
we definitely need to practice some safety procedures in the imaging department. Thank you so
we
much,
always
Chandra.
have patient transfer safety, so moving
Yeah.
patients, allergies, every modality that does something, you
Mm-hmm.
have to be careful in every
Yeah.
modality. So some modalities, like I say, doing MRI, my antennas are a little more because I'm not only watching out for what I do, I got to watch out for the patient, I got to watch out for my
Yeah.
coworkers, they got to watch out for me, the nurses that's coming in, the radiation therapists, the anesthesiologists. There's so many moving parts to every different modality.
Amazing.
They got to make sure they got the right French needles. I mean, it's so much.
You know, I'm in my finals. Yeah, and a lot of questions are coming up in my head right now. So, Chandra, before we proceed to the next question, you talked about injecting contrast, in the patient, during CT procedures, right? Now, tell me, Chandra, with your experience, uh, how do you like know if a patient is allergic to a particular contrast? If you set the contrast and there are some allergies that the patient is demonstrated,
Well, I mean,
how do you,
anybody can get allergic to things and you don't know it until you give the contrast. I mean, that's happened plenty of times. Sometimes you just don't know until it happens, and that's why
Amazing.
you practice safety throughout
Mhm.
the whole procedure. But what you do ahead of time is, and it's usually documented, you always look at a person's chart. You always go through and review what the previous things. People usually are asked questions before they ever get to the center or the hospital about allergies. So you usually know ahead of time. And sometimes,
Mhm.
so when the patient comes in, you ask again. You want to ask, and ask. You can never ask too much. You continue to question the patient even up until you inject the contrast. Just it doesn't hurt. It doesn't hurt to really cross all your T's, dot all your I's. And you
Yeah.
have first things you have to fill out. So people usually are aware of what they're allergic to, and then you find out their level of allergies a lot of times. Some radiologists have protocols for us to follow that if a patient has anaphylaxis to strawberries, come talk to us first before you give them contrast. Because a lot of times, their reasoning is if they're highly allergic to where their throat closes on some things, they might be more allergic to stuff than just the average person. But to
Yeah.
answer the question, we ask thorough questions throughout from the beginning to the end. Before the patient gets there, they fill out forms that ask those questions as well. And we monitor patients whenever we get them contrast before and after.
Yeah, there's some patients that are very, repulsive sometimes. They're not responsive most times. So, they're kind of like situation you go into that very pressurized. You just have to, because the reason why I asked that question is because I was speaking with a radiographer who he was trained here in Nigeria before he moved to the UK. Um, he was transferred like to band six. He was the only African that was accepted in that NHS platform in the UK. And he made mention that with he's into interventional radiology and also cath labs and CT as well. And he made mention that there are some situations that the patient is not responsive. He doesn't, the patient doesn't respond properly, when you ask him questions. You just have to, do your thing. If the patient shows some allergies with the country, you just have to alert the doctors or something. Guys is really, they're trained for that. So that's why I asked that question. If sometimes things happen, but it's fine that we practice
Yeah, I can't answer that because I'm gonna tell you if a patient don't answer my screening questions about allergies, I am not giving you contrast. And I'm gonna let the doctor come and I can promise you I have never worked with a radiologist that is going to put their license in the line. Of course, I don't know the depth of that situation, but or what all happened with that. But I just know for me, my patients fill out forms. Radiologists
Mm-hmm.
are consulted because they are the final person that's responsible for everything. So
Yeah.
we work as a team. The radiologist relies on us as technologists and therapists to be their eyes and their ears. There are certain things that our experience should say, question this, maybe pause on this and come talk to me and let me know what's really going on. And then I can get up and come in there and talk to the patient and get to the bottom of it because the doctor is responsible for whatever happens.
Yeah, absolutely, absolutely. Thank you so much, Chandra, for that one. So the next question for you is, yeah, you mentioned about owning a podcast, right? So talk us through your podcast, a couple of rat techs, amazing. What conversations have you moved, that moved you the most, and how do you use that platform to advocate for the profession in general?
I've had a lot of really good episodes, I would say, but the one that has really made a difference in me personally was the one where I interviewed the then vice president at the time he was up for election of the ASRT, Brandon Smith. I was not a member of
Mhm.
ASRT. I was years ago, but I had let it lapse and I didn't see the value in it. And I saw him on LinkedIn being very active. And at this time, you didn't see a lot of people being active about the profession. You saw posts here and there, but not on LinkedIn. You didn't see that much. And he was just going for the post. I mean, he was coming with some good stuff. I don't know if you follow him, but his posts are very provoking and make you think about the profession that you're in. He brought this fire. And I was like, who is this guy? What is the ASIT? Oh, they're really like bringing some folks in here. What is this? Let me investigate. And I invited him on my podcast. And I asked him questions. We didn't rehearse it. I wasn't planning to, like be a member. But after that conversation, I paid my dues. I have been a member. I have taken advantage of what all they, and I have seen a change in my understanding of the profession, what the things that's available to me. I mean, I was just scratching the surface of what I knew about my profession, even at 20 years. And it really made me understand being a part of associations is very important. Being
Mm-hmm.
local is very important. There were so many things I feel like I missed out on or made harder for myself by not being a member. That was one. The other one was I've had a lot of good guests on, but the other one was about informatics. I had a young lady on to talk about informatics, her transformation from radiologic technologist to interventional to informatics. She's the associate director of Penn State now, their informatics department. I mean, it really blew my mind about informatics and where it has come in the imaging aspect. You hear about nursing informatics, but the imaging informatics, I'm gonna tell you, I hope more people really look at that as an opportunity because everyone does not want to be in a clinical setting working with patients, and it's okay. I think sometimes we, even in our profession, make people feel guilty that they don't want to deal with patients. It's okay. Or they don't want to be in leadership or education. There are so many other areas, and that's what having those guests on my podcast really helped me to see the opportunities that are out there for those that may say, I'm tired of working and pulling on patients. I want to do something else, and
Mm,
it's okay.
amazing. I love the fact you mentioned about informatics. That's one of the courses I did. You know, because we have 2 semesters in a year. I'm done with my first semester, my finals. One more semester to go. And last semester, we learned a course, biomedical informatics. You know, and as you're going further with the course, the men mentioned about nursing informatics, radiology informatics as well. So yeah, amazing. Using technologies in the medical aspects for people that is not that tired, like you said, don't want to work with patients anymore. Then you have to get ready to work with technologists. There are lots of them. Thank you so much, Chandra, for that amazing initiative. So the last question for you is, all right, so for students or early career techs out there who might, feel overlooked in the healthcare system, what's your best advice for owning the value and finding the voice in the profession?
I always say learn multiple modalities. Don't feel like you have to uh, stay in one modality and get experience. Like I talk to students that say, "Well, I gotta work in X-ray for 2 years before I cross over." No, you don't. You don't. If you want to learn more, do it while you have the energy, the brain power, while that because there's a school brain and there is a working brain. Once you start working and making that money, it's hard to go back to school. It's hard. So I really encourage students to own your own career and what works for somebody else, that works for them. Take people's advice, put it in your back pocket, and then figure out your path because the profession has really changed over the last few years. And I believe with AI and many other things, it's going to change even more. When I started, we didn't have PET, we didn't have informatics, we didn't even have PACs when I started. MRI was not busy at all. So to look at things in just this period of time, imagine another 15, 20 years. So I encourage students to look at the longevity of your time in this profession, be strategic about it, have fun. You can always make money in this profession. So, make that a small part of your why. The other part is network with people with a good, pure motive, not for what you can get, because people are smart, and nobody wants to feel used. But be genuine as a student, getting to know people, know their story of why they came in, knowing what made them choose this versus that. That might be very helpful to you to figure out what you want to do in this profession. And you might say, "Oh, I thought I wanted to do that. I didn't know that." They just gave me a key piece of advice. I know I've been there. I've talked to people, and I'm like, "Oh, I didn't know that was part of it. Okay, let me turn the other way." So just networking with people, being strategic about your career, being open. Don't follow the trends on social media. I see a lot of people wanting to get into MRI because that's what's trending right now. I'm going to tell you, look at what is coming up. I just did a podcast episode about navigating, your profession. Don't look at what's now. because it's going to be something's going to be different about it in a year or two. Look at what's down the pipeline. Look at where things are going. And that means you need to be a part of your local and your national associations. You need to be active in it. And that way you can kind of know 5 years from now, oh, they're doing this on these machines. Who would have thought they had touch table scanners? They had, I mean, if you'd have seen the old scanners before, I mean, we used to have to chase the contrast. The
Oh
scanner,
my goodness.
but things are really changing now. And I just hope students really are strategic, network, and have fun.
Mm-hmm. Amazing. So thank you so much, Chandra. And you have to definitely check out Chandra's podcast. It's gonna be added on the YouTube description below. So do well to go over there and subscribe as well. Because she has a lot of contents there that are very very enticing. You know, and so yeah, make sure to watch this video to the end. If you love this content, do well to like, share, and subscribe. And thank you so much, Sandra. Do you have any last word for
Thank
wrap up
you
session?
for having me. That's first. I would like to say thank you for having me, and I look forward to continue to supporting all that you're doing, bringing awareness as a student in radiography. It's important that all of us use our voices. We each have a different story to tell. We tell it in a different way. So thank you for being yourself, and you did a nice interview. I appreciate you having me on as a guest. And to the rest of y'all, take a look at our profession if you're thinking about going into the medical field. If you're already in medical imaging, really grow and learn, connect with other students. You guys connect with your associations, whether it's in another country or locally. You could do international connections as well, but really see how the rest of the world is doing imaging. That's something I want to start doing, is seeing how other parts of the world do imaging. So thank you again, Riss.
Amazing. Thank you so much.